remember they took my blood and they left me sitting in the clinic room while they went and got the doctor. And suddenly then it hit me like a sledgehammer. And I suddenly had this wave of despair come over me, thinking this is going to be my life now, sitting in clinics having blood tests.
In 2005, Rob tested positive for HIV, the virus that causes AIDS. Years earlier, it would have been a death sentence. But as a nurse, Rob knew treatment was now available. Still, he went through a crisis, remembering many friends who'd died of AIDS.
I knew that wasn't going to happen to me because I knew we had moved on from being a fatal disease to a chronic disease. I knew there were excellent meds on the market. I think what I did go through was the survivor guilt, because I suddenly thought of all the very good people that had died of this disease, and here was I with the same thing that had killed them, but it wasn't going to kill me.
HIV kills by destroying the body's defences, allowing other infections to go unchecked. The final stage is called AIDS. In the mid-1990s, researchers found that a combination of medicines called antiretrovirals, or ARVs, could suppress the virus. While not a cure, they can stop AIDS from developing. One of the most important questions still facing doctors is how early should people start ARVs? Normally, people like Rob, who test positive, would not be given ARVs until their own defence system begins to fail, which could be years after first infection. This is because ARVs can have serious side effects, and if people forget to take them, the virus can become resistant, making treatment ineffective. The Spartak clinical trial was set up to find out if giving a short course of treatment to people who've only just caught the virus would be beneficial. At this first stage of the disease, the virus invades the body, multiplying quickly. Doctors hoped that hitting it with ARVs early on might help the immune system stay healthy for longer.
So the question was, if you had a short amount of drug to help your body, if you like, cope with this virus when it had only just become infected, which was a time when we knew that the virus was really quite debilitating to the immune system because your body is yet to get used to having it, then you could stop it and you'd have a longer period of time when you didn't need treatment before you had to go back on treatment again.
Rob was one of more than 350 volunteers who were randomly assigned to 3 different groups. One group did not take ARVs early, following current practice. A second group took a short 12-week course and then stopped. Rob was glad he ended up in the third group, who were given a 48-week course of treatment before stopping and following current guidelines. He responded well, but he had to take pills twice a day.
I'd be sitting here, the alarm would go off at 10 o'clock, and I'd suddenly think, here we go again, and it was almost a to get up and go to the kitchen. The trouble is, it does emphasise that I am a sick person if I'm starting on treatment, and I think that is one of the biggest fundamental questions about whether somebody should start treatment early or not. I think if there's very clear clinical evidence that the outcomes are improved by starting treatment, then I think we should be working to help people with that psychological barrier. But I think while the outcomes are still questionable, I think that's a difficult one.
Samarira moyo, Samarira moyo, moyo, Samarira moyo.
Spartak is the largest HIV randomised trial where volunteers have been asked to take ARVs straight after infection. Fears that they wouldn't want to proved unfounded, not only in the UK, but also in the 7 other countries where the trial was carried out, including South Africa.
It brought a hope for them, because I believe that it's normal for one to feel like because now I'm HIV positive, I'm going to die. But when they heard that they were going to be given a treatment, ARVs, so that brought a hope for them that they might live longer.
For more than 7 years, information from all the participants was carefully collected, allowing scientists to compare the 3 groups.
Actually, I'm very pleased to say we saw none of the similar complications.
The results showed no evidence of harm. None of the participants developed resistance or a higher risk of illness from taking ARVs early and then stopping. And the 48-week course did delay the time when the immune system starts to fail and people need to go on medicines for life. However, this delay was not long enough to make any definite recommendations for new treatment guidelines.
What our trial, I think, does is add to that jigsaw that people who have very recent infection who go on to treatment, first of all, it's certainly safe, and second of all, it may confer some, albeit small, benefit to that individual.
The benefit could best be seen through blood tests. Rob's group had overall lower levels of the virus, which continued even after they stopped the treatment after 48 weeks. They also had higher CD4 counts, suggesting their immune systems stayed healthier. Another trend showed the sooner treatment started after infection, the better. These are tantalizing suggestions that giving a person ARVs as soon as possible after infection by HIV could benefit their immune system. The Spartak results come amid growing interest in the idea of early treatment. Other research has shown that people on treatment have much lower levels of the virus and so are much less infectious to others. Researchers are now asking whether early treatment could be used to prevent the spread of the virus.
What's changed is that the drugs have got easier, 1 pill once a day, can't get easier than that, and the toxicities have got less and are more manageable and more anticipated, so you can warn patients about them. So the starting point has crept up. Without new evidence, it's just all over the world, the starting point has crept up. And now we're at that point in history where we can say hit early, hit hard. Perhaps we need to revisit it.
But there are still missing pieces of the puzzle. Most important, Spartak participants took only a short course of treatment. Doctors do not yet know if starting lifelong ARV treatment early would benefit or harm individual patients. This is one of the questions to be answered by other clinical trials set to produce results in 2015. ARVs have already given life to millions of people like Rob. The Spartak results add another piece of knowledge to the larger picture of HIV treatment. If ongoing clinical trials prove successful, the ARV medicines may offer perhaps the best hope yet of curbing the epidemic.